Heel pain is one of the most common foot problems affecting adults of all ages. The heel bone is the largest of the 26 bones in the foot. As the first part of the foot to make contact when walking, it is not surprising that the heel sustains undue stress. This stress can be the result of an injury, bruising from walking, running, or other activities, wearing improper footwear, and possibly from being overweight. Heel pain is typically the result of abnormalities in the biomechanics of the feet. The two structures associated with heel pain are the plantar fascia, a band of fibrous connective tissue, and the flexor digitorum brevis muscle, which supports the arch and flexes the 4 small toes. Generally, the foot functions by absorbing the weight of the body, and the arch of the foot flattens. The plantar fascia and the flexor digitorum brevis muscle stabilize the foot and sustain the arch. Inflammation and pain to the surrounding structures of the heel are a direct result of gait abnormalities. Heel pain is most prevalent in active people, those over the age of 40, those who are overweight, women, and those who wear poorly fitting footwear. The diagnosis for the cause of heel pain may involve a thorough history of symptoms, a physical examination, and imaging tests such as X-rays or ultrasound. Once a diagnosis is made regarding the cause of the heel pain, a treatment plan will be implemented. Heel pain is typically caused by stress to the structures that support the heel bone. The most common cause of heel pain is from plantar fasciitis. Plantar fasciitis is caused from inflammation to the plantar fascia, a band of fibrous connective tissue running along the bottom of the foot from the heel to the ball of the foot. When the plantar fascia is continually stretched past its normal extension, tears in the fiber occur. The result is pain, inflammation, and possibly bone spurs. Pain associated with plantar fasciitis may disappear as you perform normal activities, only to reappear with rest. The pain may also be profound with strenuous exercise compared to moderate exercise. Aggravation to the area may occur with improperly fitted footwear and from chronic irritation due to an overly athletic lifestyle. Not all heel pain is caused by plantar fasciitis. Achilles tendonitis can cause pain in the back of the heel. This condition occurs when the tendon that runs from behind the ankle and connects at the back of the heel is strained, causing tears along its length. The result is pain, inflammation, and possibly the development of a heel spur. A heel spur is a bony growth on the underside of the heel bone. Visible by X-ray, a heel spur is typically a byproduct of the strain placed on the muscles and ligaments of the foot. Bursitis, arthritis, stress fractures, a neuroma, a bone bruise, and Haglund's deformity can all cause pain in the heel as well. Excessive pronation of the foot can cause abnormal stretching and pulling of the ligaments and tendons attached to the heel bone, resulting in pain. Excessive pronation can also lead to problems with the knees, hips, and possibly the lower back if not cared for. Heel pain should be addressed by a podiatric doctor immediately. Pain is the body's way of alerting us to damage and to seek medical attention. A podiatrist is uniquely qualified to diagnose and treat pain associated with the heel. They can provide you with a variety of treatment options, as well as valuable information and education to prevent future pain to the heel and foot. After being diagnosed with a cause for your heel pain, your podiatrist will offer a comprehensive treatment plan based on your individual needs. A conservative approach will probably be implemented first. This may involve oral or injectable anti-inflammatory medications, applying ice for swelling and pain, taping the foot to support the arch, recommendations on proper footwear, stretching of the calf muscles to help with Achilles tendonitis, physical therapy, and possibly utilizing an orthotic device. The orthotic device may be beneficial in correcting biomechanical misalignments, offering support to the tendons and ligaments sustaining the heel bone, and controlling excessive pronation of the foot. The utilization of an orthotic device may effectively treat the problem without the need for surgical intervention. Shockwave therapy is another conservative approach that may be beneficial. This non-invasive surgical procedure uses sound waves to treat chronic heel pain. The process is done on an outpatient basis and typically takes about 30 minutes using local anesthesia. The shock waves are aimed at the localized site, producing increased blood flow, creating a healing response. Typically, patients are able to resume normal activity the day after treatment, although strenuous exercise and heavy lifting should be avoided for at least 4 to 6 weeks. Conventional surgery may be necessary to treat chronic heel pain that has not responded to conservative treatment. Surgery typically involves releasing the plantar fascia tissue or removing a bone spur or bursa. When the plantar fascia is released, the arch of the foot may not function normally and will require additional support. Orthotic devices will be prescribed and should be used to provide extra support and alignment for this imbalance. If the imbalances are not corrected, hammer toes and bunions may develop, causing pain and disfigurement. Heel pain can also be treated with a non-surgical therapy called radiofrequency coblation. Coblation RF is an effective pain relief modality that may be utilized in cases that are not responsive to conservative care. After local anesthesia, your podiatrist guides a catheter with a probe at its tip into your heel in the areas where you are experiencing pain. Then, mild, painless radiofrequency energy, similar to microwave heat, is transmitted to the damaged tissue, theoretically destroying the pain-causing area. This is typically a 15 to 20-minute procedure in your podiatrist's office or surgical suite. Patients are ambulatory immediately following the procedure with minimal discomfort. To date, the procedure does not appear to demonstrate significant complications. However, long-term studies have not been performed to assess its long-term effectiveness. Autogenous platelet concentration procedure, or APC, has been used clinically for over a decade and has proven to be especially effective in the treatment of several podiatric ailments, including plantar fasciitis, tibial dysfunction, Achilles tendonitis, neuroma, as well as neuropathic and trophic ulcers. Autogenous platelet concentrate is composed of platelets and plasma. Platelets are tiny cells that are partially responsible for causing blood to clot. Platelets also contain large reservoirs of natural growth factors. Growth factors derived from platelets initiate connective tissue healing, promote the development of new blood vessels, and stimulate the healing process. APC is made from a small sample of your own blood. Your podiatrist will draw blood using a sterile technique designed to prevent fragmentation of the platelets. The blood is then placed in a specialized centrifuge that spins and automatically separates the red blood cells from the plasma. The entire process takes less than 15 minutes and results in a highly concentrated amount of platelets and increases the amount of growth factors naturally found in the body by 4 to 6 times. Injecting platelet-rich plasma made from your own blood mimics the final step of the clotting process and enables the injury site to quickly heal because of the adhesive properties of the platelets. This technique enables areas that may not receive optimal blood flow, such as tendons and ligaments, to heal and regenerate. Within a matter of minutes following the procedure, you will leave the doctor's office under your own power with a sterile dressing, a surgical shoe, and follow-up instructions. Because we are using your own blood drawn at the time of the treatment and using a sterile technique, the potential side effects are nearly non-existent. This process simply enhances the body's own ability to heal by enriching the growth factors needed to accelerate and enhance the natural healing process. You will be restricted from the use of non-steroid anti-inflammatory medications for 2 weeks prior to the procedure and throughout the course of treatment. Following the procedure, physical activity will be restricted and the foot will be immobilized in a walker boot to ensure the platelets remain in sight. The procedure itself should take less than 1 hour. Bed rest with minimal activity is recommended for at least 4 days and up to 1 week if possible. If you have a tendon or ligament injury and traditional treatment methods have not provided relief, APC may be the solution. The procedure is less expensive and less invasive than traditional surgical techniques. It will heal tissue with little or no scarring, and recovery time is short. Your podiatrist will discuss all treatment options with you and come up with a comprehensive plan based on your individual needs. They will make sure you are educated and well informed about your condition and treatment. Preventing heel pain is easy when you follow a few simple guidelines. By utilizing certain steps, you can ensure optimal health for the heel and foot. These steps may include 1. Wearing shoes that fit correctly and replacing them when they become worn. 2. Wearing shoes that are appropriate for the activity you are performing. 3. Stretching properly before you do any type of exercise. 4. Not exercising through heel pain. Stop immediately if you notice any discomfort. 5. Maintaining an optimal weight through proper diet and exercise. 6. Avoid walking in bare feet, on uneven surfaces, and on rocks. Any pain you feel in the foot or heel that lasts longer than a month should be addressed by a podiatric doctor. They have been trained in the diagnosis and treatment of foot conditions and can help you retain the health and wellness of your feet. By following these simple guidelines, you can ease or even prevent heel pain.